Welcome back. If you've just joined us, you're watching the news at 10 on Channels Television, live from Lagos. A reminder of our top stories now. Police uncover plan by terrorists to bomb Abuja transport network. Security forces in covert operations to stop plot. Endgame for 3 Nigerians as London court sentences them to a total of 13 years in jail for human trafficking. Abuja residents vent their frustrations as an accident involving a petrol tanker and car cripples movement in the city. And Palestinian death mount as Israel and militants in Gaza exchange rounds of rocket and missile fire. All our top stories can be found on our website, channelstv.com, and on youtube.com/channelsweb. Please visit m.channelstv.com to view us live on your mobile device. And you can also download the Channels TV app for Android, iOS, and Windows phones from their respective stores. Or you can also interact with the Channels Eyewitness feature on our Android, iOS, and Windows 8 platforms. If you have pictures or videos to share with us, tap the application on your device, swipe to reveal the Eyewitness menu, and follow the instructions. Now, more pictures on the accident in Abuja involving a fuel tanker and a car. The second picture shows the aftermath of the crash, a heavy traffic jam which prompted the residents to cry out to the authorities to respond swiftly to clear the road. While staying on the issue of accident, the car in this photograph veered off the Benin-Shagamu highway just before Shagamu in Ogun State. This eyewitness says 2 lifeless bodies were seen near the car. One of the occupants of the car had a deep cut on his head, but he came out unaided. And finally, we go to Ash Opalobi Crescent in Asaba, the Delta State capital, where this eyewitness says these tankers loaded with petroleum products and seized by the Delta State Command of Civil Defense Corps have messed up the environment. I would like to thank you for your reports. Please do keep them coming. Well, as Nigeria battles to improve access to basic and quality healthcare delivery, the University College Hospital Ibadan, Oyo State, says it is looking to achieving efficient public-private partnership as an effective tool for improved service delivery. This is coming after a successful open-heart surgery was done on a 7-month-old baby, the youngest cardiac patient ever operated in any public hospital facility in Nigeria. The latest feat was achieved with the collaboration of expert cardiologists from America, Canada, India, and Nigeria, as coordinated by Tri-State Cardiovascular Institute led by Dr. Kumar Adeleke.
The weight of this baby is 3.8 kilograms, the equivalent of a newborn at birth. She's almost 7 months old. She could not grow at the natural pace because of a big hole in her heart. According to her mother, Mrs. Olubonume Fakoya, Litu Enriola was diagnosed when she was about 3 months old and has since then been in and out of the hospital.
Indeed, it has not been easy. The journey has been so rough. Most times you'll be in the hospital, most times on admission, because of our challenge.
The head of cardiology says that was a very delicate surgery, as the baby had emaciated so much, her chances were very slim.
I remember carrying this little baby, knowing that may be the last time I will be able to see this baby alive.
The chief surgeon said this new set of surgeries are more encompassing because it covers both extremes of life. About 2 hours after the surgery, the elated mother confirmed the success of the surgery and says that a lot of changes have taken place in her baby's body.
There is a whole lot of improvements. She's breathing well, then she responds well now.
Among those operated on is this Colombian who had an artery bypass. He spoke to Channels Television barely 18 hours after the surgery.
I did some tests with them and came and so, if it's a life-threatening thing, I don't want to go somewhere and start the procedure and so on. When there is a facility and when there are people who can do it here. The most important thing in this is the human resource.
The Chief Medical Director, UCH Ibadan, Professor Temitope Alonge, is proud of this procedure and is asking the government to find a way to subsidize the treatment so that more people can benefit.
There must be a lot of financial support from government to ensure that we'll be able to carry on this work. So what this translates to is that there should be some sharing of payment from government and the patients.
Statistics have shown that cardiovascular diseases have become a global epidemic with no demographic boundary. WHO data says 17.3 million people die annually across the world. Nigeria has no accurate figure, but out of the thousands of children on the waiting list at UCH, only a few, like 7-month-old Enriola, have been saved.
Well, all remains unsettled in public hospitals in Nigeria as the indefinite strike by the medical doctors in the country shows no sign of ending. Our focus on health tonight is on the impact of the strike and what Nigerians think of the situation. Our correspondent Yomi Otaibe reports.
It's about 2 weeks of harrowing experience for those seeking medical services in public hospitals in Nigeria. Consulting rooms are empty. Medical doctors under the umbrella body of the Nigerian Medical Association have resolved to continue their indefinite strike, which started on July the 1st and is based mainly on the leadership of the healthcare team and adjustment of allowances. Activities here at the Accident and Emergency Unit of the Federal Medical Center, Ebutemeta, Lagos, is at its lowest ebb. And this is because, indeed, the doctors have abandoned their stethoscopes.
The strike is very affecting us significantly. But right from onset, the management, volunteered themselves, especially the medical director and the head of clinical services, to render the emergency services, and that is what is still ongoing.
I was admitted from here, referred down that place, even though I would say a week after I did my surgery, the doctor now have to come down. That it's like they will do me a favor. Instead of me to be wasting my money in the ward for the food, for the ward money, so that they should assist me to go home.
Indeed, there have been series of meetings between representatives of both the federal government and the Nigerian Medical Association. The conclusions reached by both parties on July the 3rd, 2014 show, among others, that the post of Deputy Chairman Medical Advisory Committee, DC Mark, is not abolished, and the Minister of Health would issue an explanatory note to guide the implementation of the existing circular on the matter. On skipping of grade level 12 in the health sector, the conclusion shows that government has no objection to skipping or grade by doctors pending the outcome of the case before the Court of Appeal. Concerning pay relativity, the meeting noted that the government has been facing paucity of funds. However, the process of meeting the financial obligations arising from the implementation of the January 3rd, 2014 circular has commenced, and the accounts of the doctors will be credited when the process is completed. Despite these conclusions by both parties, the doctors are yet to be back at their duty posts, citing government's insincerity. But what do Nigerians think about the whole issue?
They have their reasons for, going on strike, and usually they will say the federal government backed off from what they said. So I think the federal government should agreement so that the people will be catered for.
I know most of the doctors, they have their own private hospital. They believe they can stay on their own private hospital without coming back to the government hospital. They shouldn't do that. They should just come back. I know government will really give them their demand.
Those doctors, they need to put in their mind that they are saving lives. You understand? And when you are saving lives, you have to consider so many things. You know, when you go on a total strike, people died every day. You know, people are losing their relative ones, which is not very good for Nigeria. It's not everybody that have money for, you know, private clinic. You know, it's this government hospitals that people go to. We have enormous problem. Boko Haram, and now we have doctor on strike.
I want me to cut the strike off because it's good to cut it off because of our own health and let our country be okay.
It's unclear how this will end, as two of the major issues in contention are before the court of law. But what is certain is that all those in need of medical services in public hospitals are at the moment being denied access. A further dent on the health status of the ordinary Nigerian. Yomi Otaigbe reporting for Channels Television News.
"24 hours after the Judiciary Staff Union of Nigeria, JUSUN, directed its members across Nigeria to shut down the state courts in the country, the directive has started to take effect. The union's action is to kick against the non-compliance with the orders of the Federal High Court Abuja on the financial autonomy and independence of the judiciary. Channels Television monitored the situation in some courts across the country, and our judiciary correspondent Shola Shoyele now reports.
In Akwa Ibom State, South Nigeria, judicial activities were paralyzed as judiciary workers in the oil-rich state effectively stayed away from their duty posts. These deserted premises of the judiciary headquarters on Wellington Bassi Way and the State High Court on Metro Road, both in Uyo, is evidence that the workers are sticking to their wards. The situation is the same in Rivers State, also in the south region of the country. The High Courts and the Magistrate Courts remain under lock and key, and the workers also stayed away. The workers downed tools owing to the failure of the authorities to implement the judgment of the Federal High Court on the financial autonomy of the state judiciaries. In the southwest, the customary Court of Appeal, the State High Court, and the Magistrate Courts in Ondo State were also firmly locked. Some judiciary union members who refused to speak on camera were on ground to make sure that the strike was effective. In Lagos State, also in the southwest, the courts remained open. Some judiciary workers who reported for work chose to assign new dates to lawyers for their pending cases. The implication being that some courts did not sit. Some judges, however, sat, and in those few courts, it was business as usual. The federal courts are, however, yet to join in the strike, as the National Secretariat of the Judiciary Staff Union says it will notify the federal judiciary workers on when to key in to the industrial action. Despite the industrial action, Mr. Willie Obiano, the executive governor of Anambra State, southeast Nigeria, distributed 21 cars to the judiciary workers of the customary Court of Appeal in the state.
So it's my pleasure to hand over this master key to the Chief Judge of the state, my Lord and President.
The governor, who performed the function at the early part section of the Governor's Lodge, says he's committed to the welfare of the judiciary workers in his state.
We want to make sure that their welfare is taken care of. We are doing a few things to improve the welfare of the other arm of the judiciary too, like the magistrates' quarters. We are looking at the judges' quarters, where we're trying to ensure that we provide them with some conveniences like generating sets and what have you, all in a bid to ensure that the administration of justice system in Anambra State is world class.
There is no doubt that more incentives of this nature is needed. But the judiciary workers desire above all that the state executives will begin to implement the court order which guarantees their financial independence. When this is done, perhaps the industrial actions in our courts will stop. Shola Shayeli, Channels Television News.
Well, still ahead on the news at 10, Bank of Industry says it needs about $5 billion to make impact in the National Industrial Revolution Plan. That's some business news. Join us again.